Welcome to You and Your Pets. I'm Jim Horton, and my co-host tonight is our usual expert on the show, Dr. Ernest Rogers. But we have a special guest with us tonight, Dr. Jonathan Goodwin of the Garden State Veterinary Specialist in Tinton Falls. And you are an animal cardiologist, is that correct? That is okay. And so this particular show is going to be devoted to pets and heart situations. I'd like to start, if we can, first of all, by asking about your past. How on earth do you become an animal cardiologist? You know, it's not something I was even aware existed, I'll be honest with you.
Yes, sir. In veterinary school, you learn that there's a lot of different specialties that you can choose from. And my interest always revolved around the heart and the brain. And I felt like I could do more working with the heart than I could with the brain. And so I fell in love with cardiology and took that path.
Now, where did you study, and how did you work your way into that particular specialty?
Sure, I started off. I did my undergraduate work at Cornell University, and then I went to veterinary school at Tuskegee University.
Okay, and same place that Dr. Rogers went to.
We both went there at different times. Yeah.
We won't say who was when. And after that, I did an internship, a one-year internship in South Florida, at a private practice called Coral Springs Animal Hospital.
Now just let me say that an internship is something that a veterinarian, after he's graduated, does to get experience in many different areas. It's not a specialty, but merely an overall review of how veterinary medicine works.
Okay.
Correct. You get the benefit of working with many different specialists to kind of ensure, do you really want to take that next step at becoming a specialist yourself? Then after that, I did my cardiology residency at Purdue University.
Okay. Now, when you do your residency, is it very similar to what a physician for people would do, except it's with animals of all different sizes? And how does that work? I mean, did you specialize in small animals, or did you also handle horses and cows and other large animals?
In veterinary medicine, we're not as specialized as human medicine is, but still having the specialist, we do have to go through the extra training. Like typically a veterinarian in veterinary school might get exposed to cardiology for a total of 4 weeks. That might be your entire exposure to cardiology. So in the specialty of cardiology, you spend an extra 3 years focusing in, where humans might also have to do a fellowship because they won't just stop at cardiology. They'll do the electrical cardiology or the structural heart, and they do it for adults or children, and they focus into these smaller and smaller categories. Since we don't quite have those specialties, just doing cardiology is a specialty, and we kind of do all of those things for the different species of animals.
I'm pleased to say that as a general practitioner, Dr. Goodwin is a colleague to whom I refer. And so the reason why we have specialties, as a general practitioner, typically what we do is we identify certain elements in the patient that make us aware that it is a cardiological problem or a cardiology problem. And when we've reached the end of our expertise, which is usually fairly quickly as a general practitioner, we then refer to someone who's a specialist who then takes over the case and assists us with the treatment in the long term. But the cardiologist is really the specialist that we refer to and we depend on for not only the heart, but diseases of the chest as well.
Well, let me step back, because this is a very rudimentary question, but I'm assuming that you use just about all the basic machines that humans would use. Is that not correct?
That is correct. To evaluate the heart, typically, what we'll do, other than just the physical exam, we'll do ultrasound of the heart that they call echocardiography, and then we'll also do get a printout from electrically what's going on with the heart, an ECG or an EKG.
How do you do an EKG on a squirming dog or cat? I mean,
we ask very nicely. We ask very nicely. But we have special little electrodes that actually just hold on to the skin. We don't have to shave them and put on the sticky patches. The electrodes just kind of hang on, so in doing that we can get good readings. Then we also do blood pressure and x-rays of the chest to kind of see what's going on with the lung fields.
And I think it's important to say that Dr. Goodwin actually has some very good technicians who work with him, It's no medicine, no veterinary medicine is done simply by the doctor. There's a team around us that help us, and I think
Absolutely.
Dr. Goodwin would say that a lot of his technicians carry some of the load that he couldn't possibly do without them.
I totally agree.
Now, how many years have you been at Garden State?
I've been there 4 years now.
4 years
Going
now.
on 5.
Going on 5.
Yes, sir.
And I'm assuming that that you're primarily a small animal practice. Would that be correct? I mean, you're not doing
Predominantly.
anything like equine or anything like that.
Although we're trained in that in cardiology to do pretty much any species, typically at Garden State, 97% of what we're seeing are, dogs and cats, or at least small animals.
Have you had any most unusual pets that have come through, other than, say, hamsters or something like that, which you've had to work on?
Coming through Garden State, it'll be smaller animals like guinea pigs and ferrets sometimes, but outside of there, I've been called down to the mammal rescue center in Brigantine, where I got to do a few ultrasounds of the heart on a couple of pygmy sperm whales.
Oh, no kidding.
Yes, sir.
And I think we were talking, you say you've done some apes,
Yes,
some
gibbon
large
apes.
large cats.
Gibbon
as
apes,
well.
cougar, black bears, ultrasounds on all of them.
So you must be affiliated with a zoo?
Yeah, when I was in Florida for a short time, I would actually go into, there was a small, I guess, sanctuary for animals. It wasn't quite large enough to be a zoo, but they would call us in a lot to come in and kind of help with some of the animals. And also I worked with the Indiana State Zoo to go in there, and that's where when they'll have a problem with one of these animals and they believe it's a heart problem, they'll call in a cardiologist. There aren't very many of us. There are probably about 250 in the nation right now.
Is that right?
Yes, sir.
Okay, now I just have to, I know this is a ridiculous question, but I have to ask it anyway. How much different is it working on a wild animal than working on a house pet?
They both can be pretty wild animals. Typically with the wild animals, the ones that we know are very highly unpredictable, we will often sedate them so that we can be safe. But you also have to safety comes first, as Dr. Rogers will tell you. Any animal can do anything at any time, and part of your veterinary education is learning to, I'm not saying you're really communicating with them, but you're reading their body language to know what they're saying before they actually say something with their teeth.
Or do something, yes. Yes,
Exactly.
yeah. Now, your education has carried you a lot of places.
Yes, sir.
Are you satisfied with what you're doing? Are you happy as a veterinarian and a cardiologist?
I love it every day. It's not even like work. It's going in and having fun.
I think it's reasonable to expect that most veterinarians feel that way about veterinary medicine and working in the profession that we've chosen.
Absolutely. The saddest part is when you have an animal that you can't help, or you reach that time, and just helping the parents through that rough time. That's always difficult.
Okay, well, I would like to turn, if we can, to some of the major issues in cardiology that you are dealing with on a daily basis.
Sure.
So, what kind of a situation is referred to you? So, Dr. Rogers gives you a call and he says, I'm sending you a Labrador, and it has what typically?
So typically what happens, the heart's interesting in that sometimes it'll actually send you signals that you can actually hear when you listen, when the veterinarian listens with their stethoscope. They can hear abnormalities in the heart sounds. Typically the heart sound has a pretty nice regularity to it, and it tends to be two pretty distinct sounds. People often call it lub-dub, lub-dub. And so sometimes instead of hearing that lub-dub, you'll actually hear what they call a heart murmur, or abnormality in blood flow that's causing a lot of turbulence. That turbulence suggests there's something abnormal potentially going on. So Dr. Rogers might hear that and say, hey, this needs to be investigated further.
I have to ask a question. Do you do heart surgery?
Yes, sir. We do a lot of cardiac catheterizations. The same thing they do in humans, where they'll come up through a vessel in your leg or a vessel in your neck to get to the heart, as opposed to just opening up the chest.
Okay, but you don't do open heart or anything with a pet?
Not typically. Typically for open heart surgery, you need cardiac bypass machines to keep the heart pumping. So there are a few places that specialize in being able to do that, mostly universities, but it's not done on a regular basis right now because dogs don't typically respond very well to bypass. And at least we haven't perfected it yet. And cats are so small, it's difficult for them.
So Dr. Goodwin, in your typical day, what would be your typical day? I think we talked earlier about surgery versus seeing clients versus doing procedures versus working in the ICU. And from what I understand, you, because of your specialty, spend quite a bit of time in the ICU. So how would a typical day go for you?
Typically come in fairly early in the morning, 7:30, to evaluate all the patients that you might have in-house in the ICU to kind of check through them. Most of your cardiac patients are pretty much always going to be in the ICU. You want them intensively cared for, so they stay in the intensive care unit, the ICU. And that being the case, we evaluate them, see where their status is, see how they're handling medications and such. And then we set the plans for them that day, and we set up to see the patients as they come in. Many of the patients that come in, they get examined, get procedures done like the ultrasound of the heart or the ECG, blood pressures, x-rays, and they get to go home with medications. Some of them don't need medications. Some of them are so sick they have to stay in the hospital, or they need to be treated directly with a procedure, whether it's taking a small needle and going in and removing fluid from around the heart or around the lungs, or whether it's removing fluid from around the belly, or potentially going ahead and taking a dog to surgery or putting in a pacemaker. It's whatever needs to be done. That's what
You
we'll
do pacemakers on dogs?
Yes, sir.
I did not know that.
Yes, sir.
Is it the same thing as a human pacemaker, or is it specialty for animals?
They have some dog and cat pacemakers now, but we use the same ones that they use for humans. We use the typical same companies that they use for the human.
But isn't there different heart rates with animals from humans?
Absolutely. So what the pacemaker's real job is to prevent the heart rate typically from getting too low. It's like a little safety net.
Yeah, it's a kicker.
Exactly. So we just set the rate of the pacemaker wherever we don't want the animal's heart rate to get below. So if you have a cat and you don't want their heart rate below 100, you set the pacemaker to 100, and anytime, or 95, and anytime it gets below 100, it pops it back up. Versus if you have a dog, you might set the rate to 75 or 80, and you just don't want the rate dropping below that.
Oh, for heaven's sakes. I was not aware of that. Okay, I have to ask then, how many patients do you normally have at any one time in your cardiology unit?
I'd say we probably average having 3 patients in the hospital at any given time. Sometimes there'll be more and sometimes there'll be less, but I'd say we average maybe 3 that are in the hospital, and we might see average of maybe 7 cases a day.
7 cases a day?
And some of those will be new patients, some of those will be rechecks of patients we've seen previously.
And I'm assuming those are referrals from all over the northern New Jersey, essentially.
Yes, sir. Northern New Jersey, Staten Island very often, eastern Pennsylvania.
All along there.
Yes, sir.
Okay, well, we have to take a break, but when we come back, we'd like to talk about some specific heart situations. And this is You and Your Pet. I'm Jim Horton with Dr. Ernest Rogers, and we will be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton with Dr. Ernest Rogers, and we are talking with Dr. Jonathan Goodwin of the Garden State Veterinary Specialists in Tinton Falls. And Dr. Rogers, I'm going to ask you to take over this section because there are specific heart situations that you would like to discuss with Dr. Goodwin.
Well, I'm fortunate enough to have Dr. Goodwin not only as a friend but also as a colleague. and he was kind enough to share some of the cases he's seen, and we have some film of them. So I just want to discuss the kind of diseases that we see in dogs and how they might be mimicked or thought of by human owners as being one disease when in fact it's another disease. And I think that's what we're leading into here.
Right.
So, Dr. Goodwin, if you'd like to just start off by telling me, this is a film that you brought in, and so what would you think this would be if you were an owner? What would you think that this is likely to relate to?
Should we run the film now, and so the people can see what's happening here, first of all?
So this is the film.
And it's a dog.
This is a dog picture's being taken by the owner. The owner brought this, I think, to Dr. Goodwin to show him the events that occurred. And as we can see, the animal does recover and goes on to do quite well.
But it just falls over spontaneously.
It seems to fall over, and again, seems to fall over, and then what appears to be a seizure.
Right. Oftentimes people will think their dog or cat is having a seizure. And because that's the only word they know. They know seizure when an animal collapses and gets very stiff or the limbs begin to shake a little bit. But sometimes this will not be a seizure, but a different situation caused by heart disease called syncope, where either the heart rate or the blood pressure is not maintained enough to keep blood flowing to the brain. And if that being the case, the brain, when it's not getting good blood flow, it shuts everything down. And so they'll fall over and sometimes become very stiff and rigid for a few seconds, and usually within 5-10 minutes, they're back to normal, like nothing ever happened. This dog was exceptionally even shorter than that, but...
So you've seen this often in dogs?
Very often, on probably easily a weekly, if not daily basis.
And then how many times would an owner come in to, say, you or even me, as a general practitioner, saying, my dog has epilepsy, let's treat it for epilepsy.
Right.
And then how do you go about distinguishing those two diseases?
You know, I'd probably say somewhere upwards of 90% of the time the owners will think their dog had a seizure. And a lot of times if veterinarians aren't watchful and they just take the owner's word, they'll start treating the dog for seizures, yet the dog's not having seizures. Or the cat. Same type of thing will happen. So it takes a lot of good questions to distinguish. One of the good questions is, what was happening in the 3 or 4 minutes before the episode? Because a lot of seizures just happen out of nowhere. These syncopal events or these fainting events, they're typically triggered. Usually they're triggered by either coughing or urinating or, going to the bathroom outside.
Excitement.
Can be excitement depending on the situation. Absolutely. Any of those can kind of set them off so that they'll have these episodes happen where seizures typically happen out of nowhere. Sometimes the dogs will have them only during sleeping, right, which would suggest maybe our heart rate is getting too low and maybe that dog needs a pacemaker.
And so in these cases where you have dogs that are showing what we call syncopal or fainting episodes,
yes, sir.
Are there treatments for that kind of thing, and how does the dog go on to do in general?
Absolutely. I think our success rates with syncope, I would say probably 85% of the time we can make the episode stop. I feel pretty confident about that. The number one thing is isolating out what the cause is. Is it too low a heart rate? Okay, we may need a pacemaker. Is it too fast a heart rate? We may need medications to calm that down. Changes in blood pressure, all right, what's causing those changes? Things like that we look at for the people.
So let's explain.
Sure.
How would you take blood pressure on a dog?
Oh, sure. What we have it's pretty much set up just like a human, except for the cuff sizes are smaller. We typically use pediatric cuffs like they might use on infants or neonates. Absolutely. And we take those and we put them around their little foreleg and we'll just inflate them up and go ahead and take the measurement. So a lot of moms and dads, especially the moms, they love the blood pressures. They love them.
And so you have a dog now, you've treated it, how often after that, let's say for syncope, how often after that would you expect to see it again? Or how often do you have to see it to make sure that the medications, the pacemaker, is actually working?
Good question. Based on, again, vary a little bit with the disease, but typically after we see them, we like to see them back for a recheck in about 1 to 2 weeks to make sure everything's fine, handling medication's fine, owner's happy, dog's happy, no more episodes. That being the case, we might see them 3 to 4 months later, something along those lines, to make sure everything's going well and the heart's responding the way we want it to.
Right. And so dogs have other diseases as well.
Yes, sir.
What would be a more common disease that you might see beyond syncope?
Probably the most common disease we see in dogs as they age is they get a valve that starts to degenerate over time, almost like, if you want to think of it like an arthritis. So it starts to, instead of being a nice, even, thin valve, it starts to kind of gnarl up on the ends, and so it doesn't close nicely. And so it allows blood to leak backwards. So it would be like saying your job is to scoop water from this pool into this barrel, and you're using a little bucket, but every time you scoop there's a hole in your bucket and water falls back, so you go to scoop again, but water falls back, so you go to scoop again. And that's what happens with the heart. It gets to overworking because water or blood is flowing backwards when we want it all to go forward.
And so then again, what instruments or training would you use or education would you use to understand that problem as a cardiologist? The animal comes in.
Right.
How would you go about evaluating that type of a disease? Because I think that's pretty common. I see it quite a bit as a generalist, so I would imagine you see a lot more of it.
Yes, sir. I mean, as you know, most veterinarians will take a listen with their stethoscope. They may hear this heart murmur, they call it, and that's the blood often that's going in the wrong direction through this leaky valve. And they might send them in to get evaluated for that. Then after that, we would potentially perform an ultrasound of the heart, x-rays if you haven't already performed them. And then we go ahead and take a look at the ECG or the EKG, blood pressure. Those would be our kind of our standard things to start off with. Some animals, if they're having more arrhythmias, we might do further monitoring for them. So it varies based on, again, their need.
And so now that we've talked about these two diseases, obviously, syncope, we'll see the animal falling down or coughing, or we'll have other signs. The second disease of the valvular problems, are there signs that an owner can look for, something that an owner should be aware of? I think the signs for this, at least in my experience, are fairly subtle. So how does an owner separate a problem with a valve from a dog that just is listless, say?
That's a very good question, and it can be a little bit tough. A lot of times, one of the things that we'll notice is animals, their energy will go down. But if they're living in a situation where they don't walk very much, you're not going to see much change there. If you have a dog that you take running with you 5 miles a day, and then you start noticing around mile 3 he's starting to lag behind you, then that can be an early sign that there might be a little something going on with the ticker. Versus a dog that's always on the couch and just is on the couch.
Right.
Typically they're going to be further along. The other thing you'd watch for is coughing. One of the big signs of a heart that's giving difficulty or getting larger is the heart can cause a cough to arise from the dogs. Whether it be from the heart size getting bigger and actually pressing on the windpipe, they get this very classic cough, this and they kind of retch at the end. And they'll do this like they all read the book, when that heart gets large enough and presses on that windpipe. So little signs like that can tell us this might be going on.
Right. So it's interesting. We've been talking about dogs now, and I'm wondering, you see cats as well?
Oh, many cats.
So I think we have here what we call an echocardiogram.
Yes, sir.
Of the heart, and I think you might want to grab the pointer there, and I'll repeat this as often as you need.
Yes, sir.
To show what's happening in this heart, and go ahead and just talk about it.
So in cats, one of the big issues that we have is they tend to get more heart muscle disease, more like humans. Humans get heart muscle disease from arteries getting clogged. Cats get it just from true muscle genetic changes. In this image right here, we have this area of the heart. This is our left atrium, and bouncing around in there, you can see what looks like a white ball. That's actually a big blood clot.
Oh my.
That's trying to fly out into the body This is our left ventricle here, so the blood clot would fly from here into here and fly out to go wherever it wanted to go, potentially causing some catastrophic
Blockage.
Yes, horrible, horrible. So one of the things that we see with cats since they have this heart muscle disease is a lot of similarity to people, where you hear about the 17-year-old wrestler comes home from wrestling practice, drops dead. The 26-year-old pro football player who all of a sudden drops on the field. The 19-year-old basketball player. Young athletes who are feeling great, doing great, and all of a sudden they go. That tends to be more similar to the heart muscle diseases that we see in cats. So cat's disease, when you can see signs of it, you really want to go after it if you can to get ahead of it, because they don't often give you a lot of opportunity.
And in my recent experience, I've had several cats that have come in, one recently with a very large heart, and that heart in itself gave out during the course of my examination. So I think one thing that I would like to point out about cats, and you might agree, cats tend to be as normal as they possibly can for as long as they possibly can, and then they give up the ghost.
You're absolutely correct. I think they're a little less domesticated than dogs are. You know, when a dog is sick, you know, he lets you know he's sick, and that's why we say sick as a dog.
Right.
When a cat is sick, you know, being less domesticated, if you're out in the wild and you're sick, and you show you're sick, somebody's going to come and eat you.
Right.
So they try to, you know,
Be as
keep it
normal
prim
as
and
they
proper and stay as normal as they can. You're absolutely right.
And so with cats, we see these kind of episodes where you're kind enough to bring this piece of tape in to show us how there can be a ball clot in the heart itself.
Absolutely.
But there are other places that we can see clots. And what would be the consequences of a small clot, medium clot, or a large clot getting out of the heart and traveling through the aorta, which is the main vessel out of the heart to the rest of the body? What would be the possible consequences of that in a cat or in a dog, for that matter?
Pretty similar. For genetically, it seems certain species are more susceptible to developing clots. People actually are very susceptible, and cats. Dogs, horses, cattle, they're far less susceptible to developing clots. But that being said, a small clot, hopefully, you know, the cat will be able to deal with. Large clots can be deadly. What will happen oftentimes if a large clot leaves a cat, it often will go to the end of their aorta, that vessel leaving the heart, and at the end of the aorta goes and supplies blood to the back legs. If a blood clot flies out and blocks that blood to the back legs, the muscles in the back legs actually begin to start to die. As those muscles start to die, the cells release potassium into the bloodstream, and potassium, it will actually stop your heart if you get too much.
We've run out of time.
Yes, sir.
So I want to thank you very, very much for coming in and talking with us. This
No
has been
problem.
Dr. Jonathan Goodwin of the Garden State Veterinary Specialist in Tinton Falls, who is a cardiologist and has been extraordinarily interesting. And I want to thank you very much for being on You and Your Pets.
No problem.
I'm Jim Horton with Dr. Ernest Rogers, and I want to thank you very much for watching.